and the clinical leadership from all of our 6 Ohio children's hospitals. Many of our superintendents have been reaching out to our children's hospitals to ask them questions, so we thought it would be good to get them all on a call together so that they would have a chance to ask questions and hear what's going on in their part of the state from the point of view of the medical children's hospitals. We are blessed in Ohio to have 6 great, amazing children's hospitals. They are truly our most trusted authorities in regard to the medical care of our children. They shared on that call information about the number of children with COVID in our hospitals, the number of children with COVID in our ICUs and on ventilators. And they also talked about how Children's Hospital's ability to care for all children is being compromised because all of our children's hospitals are overwhelmed by the increases in COVID cases as well as the other respiratory illnesses that they're seeing. Just to go back a little bit, on September 2nd, the Ohio Children's Hospitals issued an open letter to all Ohioans asking us to help them protect our children by getting them vaccinated and by wearing masks in school and at large gatherings. 5 days later, on September 7th, they held a press conference to reiterate that message. And again, at that press conference, they strongly recommended that children get vaccinated when they could, when they were old enough to, and when they could not, that they needed to wear masks while in school. Today, they went even further. And today they made a direct appeal to the superintendents, to the schools, and they asked all schools in Ohio, K through 12, to require masks for staff and students during this very dangerous surge of the coronavirus. Now, we all share the goal of helping our kids, keeping those kids in school. Reasonable people may disagree about a lot of things during this coronavirus, but I think all of us, Democrat, Republican, liberal, conservative, I think just about everybody in Ohio now agrees that we must do everything we can to keep our children in the classroom. We need our kids in school so they don't fall behind, so if their parents can continue to work and not have to take time off to be home with the children, and so we don't exacerbate the behavioral health challenges that kids face by not being in the classroom, not being there with other kids. If we want our kids to stay in school, if we want our schools to stay open, the best way to do that is, of course, if the child is old enough to be vaccinated. Adults, that's adults and kids 12 and over. But if a child is too young to be vaccinated, then until we get through this, we need students who come to school to wear a mask. Well, let me go to a couple data points which we're trying to follow, and we are following every single day. Let me tell you where we are with those, and we'll go back to that. Let me look at this chart. 15% of our, Eric, if you could go back and pull the chart up for me, please. And we'll go back because I can't see it. Oh, there it is. I'm sorry. So if we look at the chart, we start off with optional, masks being optional for all students. That's 375 of our school districts. 61% of our school districts. But if you look at the percentage of students who are in optional for all students, that is 38.9%. Required, mask required for some students, almost 15%. Mask required for all students, 46%. Now, if we just look at the number of students who are now required in Ohio to wear a mask, that's what the next line is. Required for students, no, it's the next chart, Eric, I'm sorry. So there's approximately 54.4% of our total public school students today who are required to wear a mask. That is a significant increase in the number of students required to wear a mask from when school started today. So I wanted to make sure everyone had those numbers so you could see exactly where we are. Now, let's look at some data about where we are in Ohio. What's really happening in Ohio in regard to the Delta variant. And then after we do that, we'll turn and look at what's going on in regard to the Delta variant with our children. So first, let's look at the increase in hospitalizations among everyone. If you go back to the first week of July, when this Delta variant was started, we had 203 people who were in Ohio's hospitals with COVID, 203. Yesterday, that number was 3,427 people who were in Ohio hospitals with COVID. That is an increase of almost 1,600%. Just today, there were 344 newly reported hospitalizations. In regard to deaths from COVID, we've seen deaths increase in the state during the Delta surge, with 28 Ohioans dying from COVID in the first week of July when we started seeing cases increase as a result of the Delta variant. But during the last week of August, that number had gone to 147 Ohioans dying from COVID. Again, that is an increase of over 400%. Looking at cases, they're increasing uniformly across the state. Every single county is red hot. Some counties are almost boiling over, but everywhere, no matter where your school district is, they're red hot. There's no place that you can run from the COVID. Every school district is surrounded by numbers of cases that are very, very high. Let me go to the chart. Look at the next chart, Eric. What you will see on here is that every county, if I went to the lowest county, Holmes County, Putnam County, both of them are still exceedingly high. Holmes County is the lowest county, is still at 341 cases per 100,000 for a 2-week period of time. What that means is even the lowest county is 3 times what the CDC says is considered to be high incidence. If you look at some of the highest counties, Pike County, Lawrence County, Perry County, Pike County, for example, is 20 times what the high or what is considered to be high incidence. So every single county, every single county, no matter where your school district is exceedingly high. Let's look at some additional numbers. Now let's look specifically at what's going on with our children. Since August 15th, over 29,000 Ohio school-age children have had cases of COVID-19. Cases increased 198% from the week of August 15th compared to the week ending September 4th. The American Academy of Pediatrics just reported yesterday COVID cases among children have increased 240% nationally since early August when the Delta variant started to surge. But during that same period in Ohio, we have seen a 2,000% increase in cases among children. COVID cases are increasing at nearly twice the rate among school-aged children as compared to how they're increasing among the rest of the population. This past week saw a 44% increase among school-aged children and only a 17% increase among the rest of us. And over the 2-week period ending September 4th, there was an average of 909 cases per 100,000 for school-aged Ohio kids versus only 561 cases per 100,000 for the rest of us. Big difference. The 16 highest number of cases per day throughout the entire pandemic for kids aged 5 to 17 in Ohio have all been in the last 19 days. The data is now clear that there is a higher level of COVID in school districts where masks are not required. And that is some very, very significant pieces of information. Let me now go to our guests who are here. And I want to thank our children's hospitals for being here. And let me turn now to Nick Lashutka, who heads up the Ohio Children's Hospital Association. And Nick, I know that you have with you some of the children's hospitals, and please share with us whatever information you all have.
Thank you, Governor. Good afternoon to the media. As the governor mentioned, and as we've shared with you, children and their healthcare providers are facing a perfect storm. It's a combination of COVID driven principally by the Delta variant, which is affecting kids in 2021 in a way that did not happen in 2020. Secondly, there is unseasonably high respiratory conditions that we've never seen in the summer. We're at what we've called peak winter busy with RSV, parainfluenza, rhinovirus. 3, our behavioral health census, which even pre-pandemic was at a crisis, has been on the rise and continuing to rise, both inpatient and outpatient. And the 4th component of this, which you'll hear more about, are key staffing challenges that our institutions, like many other parts of Ohio, are facing. Our message that the governor explained to the superintendents is what we've been sharing with everyone, including you, and that is, we believe everyone can agree that our #1 priority is to keep children in school in person 5 days a week. And we have the tools that will help us to accomplish that goal. And that's what we shared with the superintendents. I'm pleased to be joined here this afternoon by some of our key children's hospital leaders. We're going to hear first from Debbie Feldman, who is the president and chief executive officer of Dayton Childrens, who can give some perspective on the CEO open letter that the governor referenced and that we shared with all of you 2 weeks ago. Following Debbie, we'll hear from Paula Grebe, who is the chief nursing officer and vice president of patient care services at ProMedica Health System, and Russell J. Ebi Children's in Northwest Ohio. Following Paula, we'll hear from Dr. Rustin Morse. Dr. Morse is the chief medical officer here in Central Ohio at Nationwide Children's, who's providing care to not only Central Ohio children, but Southeast Ohio children. And then we'll be followed and concluded by Dr. Patty Manning. Dr. Manning, as you all have heard, is the chief of staff at Cincinnati Childrens. And all these folks are happy to answer questions at the conclusion. So with that, Debbie, I will turn it to you.
Thank you, Nick, and thank you, Governor, for letting me share some insights as to what's happening here in the Dayton region, and also on behalf of my fellow colleagues, the CEOs of the other children's hospitals in Ohio. As the governor said, Ohio truly is blessed to have some of the best children's hospitals in the country, and we pride ourselves on meeting the needs of our kids and their families. This is something we believe that we do, and we do it extremely well. But I would tell you that this commitment, this desire is really threatened right now with a surge in demand that has been unprecedented for many of us. We are dealing with a disease that we've all been facing for over 18 months now. And for a long time, it was really perceived as a disease that did not impact our kids in a significant way. Well, that belief has really been shattered over the last several months, and the governor shared a lot of that data. 25% of the cases in the state of Ohio are kids, and we're feeling that in our children's hospitals. We're seeing demands in our emergency departments and our access points at unprecedented levels. Just to give you a little bit of a perspective from the Dayton region, from Dayton Childrens, we have been in red bed status here at Dayton Childrens 55% of the time since August 28th. Today, we had two beds available in the hospital for children who need them, excluding our NICU and our behavioral health beds. Those children in the bed on any given day in the last few weeks have ranged from about 11 to 17 children that are in the hospital with COVID itself. But they're also in the hospital with a variety of other respiratory and just other needs that children have a children's hospital for. The demand at our access points is absolutely staggering. If we compare September 2019 to September 2021, because we really can't use 2020 as a guide because we know it was a very unusual year, our emergency department utilization is up 41%, our urgent cares are up 37%, and our Kids Express, which is sort of more of a lower acuity, up 55%. This demand is absolutely creating a unsustainable pressure on our staff. Even if you don't think your child's going to get COVID or your child isn't going to get really sick from COVID, I guess what we really want to help people understand is that when our emergency departments, when our access points are this busy, it prevents the staff from timely addressing other needs that come into our emergency department, whether they be other respiratory diseases, concussions from Friday night football, asthma attacks, injuries, traumas. The emergency departments become slower. And in some cases, because of the wait, parents give up and they leave. And we call this leave without being seen. One day last week at Dayton Childrens, we had 40 families leave without their child being seen. On a given day, under normal circumstances, we have zero children leave without being seen. This risk of children leaving without being seen in an emergency department is something that weighs very heavily on all of us, and we do everything possible to prevent that from happening. The reason for this surge is manifold, are certainly multifaceted, and our clinicians on this call can address that certainly better than I. We are seeing very high levels of respiratory diseases such as RSV, which impacts our small babies particularly. We're seeing a surge again in behavioral health. Unfortunately, as our children go back to school, behavioral health issues really rise again. All of this happened coincident with the opening of school unmasked. It correlates directly in the timing of schools reopening. Our staff is simply getting exhausted. They go above and beyond every day in every single one of these hospitals. They are some of the most compassionate and talented people this state has, but they're getting exhausted. They just don't see an end in sight. And they too have families who are being impacted by this. They have families who have children. They have children in school who are coming home either because they are getting COVID or they are being quarantined because they've been exposed to COVID. And that's impacting our ability to provide care. We've had a 4-fold increase of staff out because of illness, and about 93% of that is related to COVID. So when that happens, we don't have the staff we need here to address this really significant surge. So the question becomes, what can we do? The governor said it, and I believe there isn't anyone in this state who doesn't want to put our kids first. They are our most precious resource. So what can we do to protect our kids? And as children's hospital CEOs, as children's hospital clinicians, we believe very clearly, as we stated in our letter, that certainly if children can be vaccinated, if we as adults can be vaccinated, we need to be vaccinated. That is certainly an important way to protect our kids. And then from the perspective of our children, until this surge declines, until we can get back into some sort of manageable level of COVID, we really need our children masked in school. It's the only way that we can stop this surge and keep our kids in school 5 days a week learning, which is what they need if they're really going to thrive. It's also what we need to bring down the volume of demand for our services. We know this works. We know last year when our kids were in school and masked, we did not see this demand. We also know that masks do not harm children. They do not create illness in children, and that they are what will work. And I'll just share with you our colleagues up in Akron Children's were able to review 1,070 kids from the Summit schools who were required to quarantine in since August 16th. Only 23 of them were from schools that there was no mask requirement. So of the 1,070 children that were required to quarantine, only 23 of them were in schools with no mask requirement. After Akron Children's was able to share that really stunning data, many of the schools in Summit County pivoted to requiring masks, and the quarantine numbers of kids in quarantine dropped 72% prior to the week before. So we know this can work. We know we owe it to our kids to make this happen. So we would just, again, urge all of our schools, all of our superintendents, all of our school boards to hear this data, to require masks in school for a period of time. I think we recognize this doesn't have to be forever, that as we see the incidence of virus decline in our communities, we can relook at this. But for now, the most important thing we need to do is make sure that our hospitals are available for every child who needs us and keep our kids in school. So thank you.
Thank you very much. We'll go now to Paula Grebe, who's the Chief Nursing Officer of Toledo Children's Hospital.
Thank you, Governor DeWine, and appreciate all of you being on this call with us this afternoon. Wanted to really take this opportunity to share much of the same information that you just heard so beautifully well spoken by Debbie. In the Northwest Ohio area, in the city of Toledo, at Children's Hospital, we have seen a significant increase in our inpatient and outpatient volumes for kids who have been sick, including kids with COVID. To share some perspective, our volumes inside the Children's Hospital have been over 100. Our average daily census has sat over 100 since the second week of July. That is unprecedented for us. Usually, volumes in the Children's Hospitals drop in the summertime months. We have seen a significant increase in the number of patients admitted with things like respiratory illnesses, RSV, parainfluenza. Again, those are wintertime processes that we see in our kiddos, usually sometime after November. Throughout the winter months, we have seen that consistently since July. We're running an average daily census of roughly 3 or so children now who are COVID positive. I think it's really important to point out in our geography at Children's Hospital over the course of the last 4 weeks, we have seen a steady and significant increase in the number of children who are testing positive for COVID-19. This last week, we've seen a total of a little more than 2,100 children who have tested positive for COVID, and the positivity rate for us is 12.7% of all tested. That's up significantly. Over the last 8 weeks, we sat about 2.5%. 4 weeks ago, we were at roughly 8% positivity rate, so a significant increase to 12.7% of our kids who are tested are now positive for COVID-19. As Debbie mentioned, we are being overrun in virtually all of our access points by sick children since the resumption of school for us in August or so. Our primary care physicians, our urgent cares, and our emergency departments are inundated daily. Certainly that holds true for all of our pediatricians in our Children's Hospital. But I will share, we had a very significant and very frightening event occur for us last night in Lucas County. At 10:36 p.m. last night, all of our Lucas County emergency departments went on EMS bypass. That includes Children's and all of our adult hospitals. What does that mean? That means that if a rescue squad was called for a 911 call and needed to pick up a patient and deliver them to a hospital, if that hospital is on bypass, that rescue squad is not allowed to stop at that hospital. Every hospital in Lucas County was on EMS bypass simultaneously last night. It's the first time it's ever occurred in any of our recollection of the last 30 or so years, unprecedented for that to occur. What happens at that point in time is our Toledo Fire and Rescue, our Lucas County EMS system, goes on what's called code red alert. And as every EMS call comes in, they are dispatched one at a time throughout the community to our individual emergency departments. What does that mean to our folks? That means that you don't necessarily go to the emergency department that's closest to your home or most likely suited to take care of your direct patient needs. It might mean that a 3-year-old who's in need of an emergency department that's specifically for pediatrics is delivered to a traditional ED because that's who's next in the queue. This is an unprecedented event for us, and one that's, as I said, a bit frightening for us, more than a bit frightening for us as well, because it speaks to the volume of sick people that are being managed in our systems as a whole. Certainly that impact included our DeWine's Children's Hospital emergency department as well. That situation lasted for us in Lucas County for over 8 hours before we were able to alleviate some of the volume issues in 4 of the local hospitals, including our very own, to come off of bypass. Again, unprecedented for us to have ever been in that event, and definitely something that's very concerning for us as we strive to care for the youngest and the most precious of our resources. We know a path forward here to help alleviate the pressures that exist from the overwhelming numbers of patients being seen in access points. As Debbie said, and as you saw in our open letter from our CEOs from all of our state children's hospitals, we are asking for assistance from our schools and our communities to help us. If you have a child old enough to be vaccinated, please do so. As an adult, we should all be vaccinated. We know that masking works. You've heard some of the data, and we'll hear more as we lead forward. It's vitally important that we do these things to protect our children and really to find an answer to the overwhelming number and surges of patients that are being seen in our facilities across the state of Ohio. Thank you.
Thank you very much. We'll now go from Toledo to Columbus. Dr. Rustin Morse, Chief Medical Officer, Columbus Nationwide Children's Hospital. Doctor.
Thank you, Dr. DeWine. Governor DeWine, I appreciate the opportunity. I'll keep my comments quite brief. We are in uncharted territory across the state from a medical perspective, not just across the children's hospitals, but across the adult hospitals as well. The infrastructure to care for patients is being strained to a point where it's never been before. The staffing shortages are causing significant disruptions in healthcare delivery across the entire state, including children's hospitals. Couple that with RSV, respiratory syncytial virus, viruses we're not typically seeing in the summer months, as well as COVID. The children's hospitals are also quite strained. We are seeing record volumes here at Nationwide Children's Hospital. We have over 30 children admitted today in the hospital with COVID, 10 of whom are in the intensive care unit. And our emergency departments and urgent cares are seeing volumes that are over 1,000 a day across the system, which is probably 30 to 40% above where we should be. So we are asking for everyone's help to get vaccinated if you're eligible, and to wear masks in school or in large gatherings as well. Thank you.
Doctor, thank you very much. Now to Dr. Patty Manning, Chief of Staff, Cincinnati Children's Hospital's Medical Center. Doctor.
Thank you, Governor. And I'll just reiterate what you heard the others share. Our numbers, our inpatient numbers, are the highest they've been during this entire pandemic for COVID positive children. Our ICU numbers are the highest they've been for this entire pandemic. Our children on ventilators with COVID are the highest they've been during this entire pandemic. Our emergency room and urgent care volumes and volumes in our primary care offices are equally overwhelmed, as you've heard across the state. That impacts the care of all children, not just children with COVID. We had an analysis down here in Greater Cincinnati of 7 school districts, some of which are partially masked and some of which are fully masked. And we were able to look at the difference between COVID positive children, so not quarantine children, but children testing positive for COVID, almost twice as likely to test positive for COVID if they were in a partially masked versus a fully masked school district. We feel like that, as well as many other examples that you've heard, is evidence for the efficacy and the usefulness of masks. So the last,
Doctor, let me interrupt you. I want to make sure I got it. Give me that figure again. You're comparing what kind of school versus what kind of school?
We're comparing schools that are fully masked, K through 12, with schools that are partially masked, just K through 6. And in the K through 6 districts, we had almost twice as many children test positive for COVID, not quarantine, but actually have COVID. And so that leads me to my final point and my final plea with you all, and that is that we have 2 paths forward. One of those paths to end this pandemic is one that many of you have asked about and many people have referenced, and that is, well, why don't we just let everybody get sick? To some degree, that's what we're doing right now. That's why we're all struggling. That's what we're all feeling the stress and strain of. So we could just let everybody get sick, including children. And for whatever reason, we put children out in front of us and let them get sick. Some of them will get very sick. Some of them might die. They will overwhelm our healthcare systems, and that will affect the care of all children in Ohio. That's one path forward. The other path forward is to use tools that are safe, effective. In many cases, they're benign. Wearing a mask is not dangerous to your health, as you've heard. And these tools minimize people getting sick, minimize children getting ill, having long COVID, minimize the strain and the burden on our healthcare system, and allow kids to stay in school. And I choose that path. And I plead with you as school leaders, as superintendents, as school board members, as community members who put lots of pressure on your school leaders. Please understand what we're asking you, and please do this small, small thing and allow children to be masked in schools throughout the grades, all the grades, and please get vaccinated. It means everything right now.
Doctor, thank you very much.